Improving our ailing healthcare system, just one of the many key issues facing the incoming Obama administration. Our next guest says that is a daunting task and predicts a healthcare bubble will be the next to collapse. Joining us to explain, Dr. Winifred Hayes, President and CEO of Hayes Incorporated. That is a healthcare think tank which advises hospitals and health insurance companies about new medical technologies. Doctor, it's a pleasure to have you with us today.
Thank you, Melissa. It's a pleasure to be here.
From a patient's perspective, from a consumer's perspective, what does a collapse in the bubble in healthcare look like?
Well, I think it looks like a mess, like a crisis in progress. And by that I mean we're seeing ever-rising healthcare costs each year. More and more costs are loaded on the system. And we're not getting our money's worth. If we look at our country as compared to the rest of the industrialized world, we do not lead in life expectancy. Our infant mortality is higher than it should be, and we're spending nearly 17% of our gross national product. And it's because we failed to adhere to some basic principles that are really important in healthcare, and that's adhering to what the scientific evidence tells us works and doesn't work in terms of improving healthcare.
I'm sorry, could you expand on that? Because I'm not sure I know what you mean.
Well, what I mean is we sometimes embrace new medical technologies. Sometimes we buy medical technologies for which we really don't have a good understanding of how much improvement does it bring to patient care. Is widget A as good as widget B?
How would you correct that?
I'd correct it by requiring that we look at what the scientific evidence tells us, and we require a high quality of evidence that really allows us to compare the effectiveness of one treatment approach to another.
I don't mean to imply that I'm in favor of spending willy-nilly, but don't you have to be careful here that you don't choke off innovation?
Absolutely. Innovation's critically important, and we all benefit from it. But on the flip side, we can't keep spending 50% more, 100% more for a new medical technology for which the incremental gains in patient improvement are negligible. In other words, me-too items that cost 50, 100% more than the older item they're replacing.
So, Dr. Hayes, if you had to give advice to the Obama administration as to where to spend and how to spend most efficiently, what areas would you recommend?
Well, first and foremost, I think there's an initiative in Congress that has a lot of merit, and it's a bill to fund comparative effectiveness research, meaning research that looks at how good something works as compared to something else. My one qualifier with respect to that bill is that it not focus on creating a new federal agency to solve all the problem, but rather it fund primary research that is conducted to figure out what works better.
Are there certain technologies, infrastructures that you would also say need some spending, a shot in the arm, so to speak?
I think the need for comparative effectiveness research is across the entire industry. So it'd be for drugs and biologics, it'd be for medical devices, it'd be for new